what are the benefits of therapy or the right psychiatric care? And really, what are the benefits of, you know, pursuing the path of getting help in these situations for people, whether it be through a therapist or a psychiatrist or whatever it is? What are the benefits?
Clem, do you want to start? Or do you want me to start?
Uh, it's up to you. I'll throw in they're just the super quick. I could think of it almost on two levels, which is there's sort of the immediate benefit, which is usually when people reach out, they're in distress, right? I don't know if, Stacy and Zach, you guys find that true, but most people aren't reaching out going, I think this just would be good for me to do. And I'm like, and maybe down the road, if ever an issue comes up, I'll be better prepared. It's like, that's usually when they show up. It's not that. It's like, we're in crisis. I'm struggling in this way, or this thing is falling apart in my life, or, I'm having a difficult time dealing with a particular set of emotions or experiences. What do I do? And so, it's like the first most obvious benefit is to help alleviate distress in a given moment. I think the bigger picture benefit is that working through difficult things makes you stronger. And then a stronger you goes back out into your life and faces everything else in your life in a healthier, more balanced, more confident way. And so there's sort of like the immediate benefit in whatever you're working on. And then maybe the bigger picture benefit in terms of the ways that we become transformed. And it's like, how many people have probably the three of us seen over the years who didn't know how to open up and share, or weren't in touch with their own emotions, and through the process of working with us learned either how to feel comfortable sharing with someone else, or learned how to get in touch with their own emotional experience, and that helped them in whatever they were going through, but then also helps them in the rest of their life afterwards and all the other pieces where they can now relate in different ways. So yeah, some thoughts on that. What about you guys?
Yeah, and I'm just thinking of really well put. I'm thinking of the other pieces too, because there's more to the puzzle than just the individual practitioners too. Like, some of the benefits of seeking help is someone realizes they really have a drug problem and they need to detox and get treatment. Maybe there's a biological issue that's causing depression. And I've had people spend 10 years and tens of thousands of dollars on therapy, and then Prozac saved their life. And I'm not a drug pusher. I'm really conservative when it comes to meds, but sometimes biologically something's off, and all you needed was a little bit of a biological switch, So I think that, and that's where it gets complicated. That's why you need someone who's collaborative, who can say, okay, I do this, but this person does this, and this person does this. I have patients who their drug and alcohol counselor was really the missing piece of the puzzle, even though they've gone to every other which way to get mental health treatment. So, or even their sponsor, for free in a 12-step program. So I think that one of the benefits of just starting the journey to get help, which, like Chaim said, usually happens in crisis, is that then you really if you really sort of investigate, your doors open to all sorts of other means of help. Maybe your partner needs help, maybe your family needs help. And the truth is we all need help. And a lot of us, especially in America, don't make time. And sorry, I guess you're in Canada's too, maybe not as much though, don't make time for ourselves. So even just making space to look at ourselves and think about, what we can improve. I think that sometimes alone is huge. And then adding the benefit of guidance from a professional just takes it so much further.
Yeah, those are such great answers, and also two really differing perspectives that I think work really well together. Like you said, Stacy, having someone who can understand the biological component. Maybe it's just a shift in physiology or brain chemistry. Like, that little tweak can help alongside with somebody who can listen in an empathetic way. I remember the first time that I went to therapy, I walked out of there and it was like I was like floating. I had a good therapist, and clearly it was a really good experience, but I just remember feeling this weight taken off of my shoulders in a way that I had never experienced before. And I always think a lot about when we are able to voice the things going on inside either our hearts or our head, when we're able to articulate them to somebody else. And that is, I mean, if anyone's ever heard me talk before, I say this a lot, right? Like when it's met with compassion and empathy and not with rejection, it allows an individual to continue to do that throughout their life. And so I think the right therapeutic relationship and the right practitioner will allow one to speak with open arms and compassion and empathy. And I think that can remove weight from people, and they are able to voice their stuff in a way that is receptive. So yeah, and for sure, working in tandem on a team is ideal. Not always possible, given perhaps where you're located or finances or insurance or all those things. But if you can work together with a team of individuals, and that's something that you need, I think that that's quite helpful.